welcome from Homeopathy 360. And as we are back again on the Beyond Boundaries Homeopathy 360 webinar series, and we are back with another passionate homeopath with the due all respect. Today we have Dr. Samir Chaukar, sir. A very warm welcome to you, sir.
Thank you very much.
So, Dr. Professor Samir Chaukar, MD Homeopathy, FCAH, DND, HMD UK, PG Homeopathy London, PG Addictions Treatment Canada. Dr. Samir sir has graduated in homeopathy in 1992 from Mumbai University, India, followed by post-graduation through British Institute of Homeopathy, UK, and MD from prestigious world-renowned Mumbai University. He has also pursued post-graduation in addictions treatment from Canada and fellowship in advanced homeopathy from Other Song International Academy. His deep connection and passion for teaching has motivated him to be attached to various homeopathic colleges and outside Mumbai as guest professor. He was a professor at YMT Homeopathic Medical College, Mumbai, in Department of Materia Medica for 15 years. That is really very long, sir. He is presently attached to Dr. Batra's Academy, Mumbai, and he is attached to Homeopathy Dergiri in Turkey and whatnot. Dr. Samir sir has been teaching and practicing homeopathy in India and abroad since last 30 years and has specialized in treatment of allergies, asthma, arthritis, autoimmune disorders, ADHD, autism, and other learning and behavioral disorders. He has presented various research papers at national and international levels. That is very really inspiring, sir, that you have involved in so many teaching fields and you have achieved so many achievements and we really happy to see that such homeopaths and such passionate homeopaths we have in India. So thank you so much, sir, for coming on this platform. First of all,
Thank you, Mansi. The pleasure is mine.
thank you, sir. And we have a very interesting topic. Today we have the topic is the scope of homeopathy in cases of autism. So, sir, as we see in today's, like we are seeing autism cases are, they're very familiar and we see how these cases are increasing day by day. So, sir, my first question to you, that is the autism was already there back or it is now the people are aware now, that is why we are listening autism in children here and there. So was it the same as the back in the earlier years or we are getting aware now?
So I think this question has two answers here, Mansi, because autism was already there. It was less recognized. It was less diagnosed in the past because initially when autism was discovered, right in 1942, it was supposed to be a kind of a schizophrenia in
Okay.
children. Because children of autism used to be always aloof, they never used to mix with people, which is a common symptom of schizophrenia. So it was thought to be schizophrenia. So this was existing already, and slowly as psychology and psychiatry developed, people started knowing that this is something else, and it is a spectrum. It is not one single thing, but it is a spectrum, right from right side to the left side. So they named it ASD, that is autism spectrum disorder.
Yes,
Now, the
sir.
second part of the answer is that though it was always there, but it has been frequently seen now, because first is the diagnostic modalities are more, the psychological tests are more,
Yes.
awareness is more. But the third thing is there's a lot of other aspects like consanguineous marriages are there, vaccinations are there. Too many vaccinations are there, which were not there in the past. Remember that now vaccines for everything are coming up. So vaccines have their own side effects. I wouldn't say that vaccines cause autism,
Yes,
because
sir.
otherwise we all would have got autism because we are all are vaccinated,
Yes, sir.
isn't it? So vaccine is the exciting cause, but there has to be something called predisposing. In homeopathy, we know there is something called a predisposing
Huh.
cause and a
Huh.
precipitating cause. So the vaccine can be a precipitating cause, but the predisposing cause is the genetics. So there has to be some problem in the genetics which can lead. So too much TV time, especially in COVID, we see that post COVID we are seeing a lot of cases of autism. Why? Because during COVID there was lot of gadget time. Children were at home, school children did not go to school, college people did not go to college. They were stuck to the computer, tablets, and continuously watching lectures or watching videos, movies, whatever, on the
Yes.
computer, on the tablets, and this led to a complete shift in the whole autism spectrum. So post COVID we are seeing a lot of. So the second thing is this pollution, the eating, the more processed food, gadget time, consanguineous marriage, and of course the most important thing, my research topic, when I presented a paper in LMHI Spain, I discussed on the role of abuse in pregnancy leading to autism. So all the women, all the girls who got married and who were abused either physically, sexually, emotionally, financially, they
Okay.
also developed or they gave rise to children who were not exactly normal. Could be autism, ADHD, whatever. But autism formed a major crux or a major crunch of children who were born post abuse in ladies. So that is in short an answer to your question, because it was also recognized, but it
Uh,
is also there are some other causes after the discovery of autism.
okay. So by the word abuse, you mean the drugs that mother is taking while pregnancy, plus also the emotional trauma that ladies are
Yeah,
having.
yeah. Abuse, I am meaning emotional trauma only, basically
Emotional
emotional trauma,
trauma.
not the drugs and all. Drugs, yes, drugs do form a major thing, but usually, see, you can avoid drugs in pregnancy, but you cannot avoid abuse. I mean, if a husband is abusive, you
Huh.
may take all the care not to take various drugs, allopathic drugs, and all that, but still the abusive behavior of the husband stays,
Mm.
right? So the effect will be there on the child, and especially in the first formative months of the pregnancy, third month, fourth month, fifth month, when these abuses are more, that is where the formative years of the formative months of the fetus.
Uh-huh.
That is when the abuse is more, and it can cause genetic damage at that point. Remember that.
Okay, okay, okay. Okay, so let's I think it's better to start with basics. So
Yes.
how to recognize autism, or please elaborate what is autism.
See, autism means in his own world, in his or her own world. They are in their own world, they are in their world of solitude, they are
Mm.
just there, they don't know what is going on around them, they are in their own world. So, in autism means, auti means within yourself, apne aap ke andar rehna. That is autism, right? These children, the first thing is that, see, remember when the child is growing up, when the mother and the father are looking at the child is growing up, there is a lot of apprehension, anxiety, as well as happiness that the child is growing up. We always take photograph of the child started crawling, child started holding his neck, the child gave his first social smile. All these are such important milestones, not only for the children but also for the parents, who are the first time parents, who are always looking at the child कि मेरा बच्चा कब हंसेगा.
हाँ हाँ.
And then 2 महीना हो गया, 4 months, 6 months,
Mm.
8 months, he doesn't give you a social smile. He doesn't even look at his mom. When the mom says, "Arey babu, kya ho gaya? Where are you? Hello, hi," and looking at him, but the child does not look at her. The child does not give smile to her. The child is absolutely emotionless. And now this is a big shock to the mother as well as the father. Remember. So lack of eye contact, not able to speak, not able to understand what the parents are wanting, as if he is deaf. Therefore, the first thing that the parents feel is that the child is deaf because he's not looking at them when the parents call him. Even if the child does not tell them the demands, whatever he wants, he will show by finger or whatever. And many a times the child undergoes a normal milestones up to 2 years or something like that, and then starts regressing. Therefore, we have two types of autism. There is a one is which is a primary autism, and then there is a secondary autism. So, in primary autism, the child is born with autism like symptoms, and therefore the problem is during the pregnancy. Remember, because the child has some problems during the pregnancy. While
Mm.
secondary autism is this child is okay for certain time, maybe 1 year, 1.5 year, 2 year, and then starts developing autism. So
It
you,
develop after.
so you need to differentiate these two. So mother's history during pregnancy is not important in all kinds of autism. In autisms which are right from the developmental part, right from the birth, the mother's history is more important rather than the regressive autism which starts after 2 years or something like that. But ailments from is very, very important. From where does this come is very, very important.
Okay, sir. Okay, so can you also share the very basic or common symptoms that through which we can recognize autism, and what are the red flags that parents should look out for that your child is having autism?
See, when you define autism, basically autism is, it begins in early childhood, okay? And
Hmm.
here, the important thing is that there are a lot of limited and repetitive patterns of behavior. There is a
Uh-huh.
lot of problem with social interaction, communication, socialization. They are
Hmm.
not able to socialize with others. Normally, when you see a child, even if strangers come, either the child will run away from the stranger or will
Uh-huh.
go to the stranger and try to talk to the or socialize with them. This is a normal because we are human beings. We are social animals. We like to meet people. We like to talk with people. We like to socialize with people. Here, the child will remain aloof as if there is nobody around. I mean, even if there is a party at home, this child will sit in the corner and playing with his own game or whatever, not understanding that there is something going on around him. So there is a problem in social interaction. There is a
Hmm.
problem in communication, and there is a limited and repetitive patterns of behavior. He'll do the same thing. Even when you ask him his name, what is your name? He'll say, what is your name? He will not say what his name is, but he'll repeat. And you say, my name is Samir. He'll say, my name is Samir. This is known as echolalia, one of the characteristic symptoms of autism.
Okay, okay, sir.
So, and plus, he's always doing something repeatedly. This is very, very important as
Hmm.
far as even homeopathy is concerned. They
Hmm.
just keep doing the same things again and again. See,
Okay, okay.
yeah, this is the basic symptomatology. This is how autism looks like. Now, if you look at the other symptoms of autism, of course, there are behavioral symptoms, there are sensory symptoms also, there are
Huh.
speech symptoms also. When there are behavioral issues, there could be a lot of hyperactivity. Now, remember, 90 to 95% or even more than that, children with autism are hyperactive, running from here and there as if there is a, as if there is a motor to their legs. And
They can't stand still.
yes, they cannot stand
Keep
still.
moving. Hmm.
Therefore, our remedies like tuberculinum, tarantula, medorinum, nux vomica, belladonna, these
Oh,
are kind of important remedies. Now, though hyperactivity becomes an common symptom of autism, and when we were in the college and in our practice also, we know that the
uh-huh.
symptoms of the disease are not so important, but symptoms of the person are important, right? So, will you take hyperactivity in your anamnesis? That is a big question. But I feel you should take it in your case taking because it is exaggerated. Remember, a person moving from one place to another place, okay, but hyperactive jumping or climbing or running on the road, this is something characteristic which we all have to take into our repertorial totality also. Are you getting it? So the
Yeah.
child could be hyperactive. There could be a lot of temper tantrums which are known as meltdowns. The autism language of temper tantrums is meltdown. There is poor attention span even if he goes to school or even if he's talking to you. If you have seen Asperger's syndrome in My Name is Khan, if you look at Shah Rukh Khan, when he's even talking to Kajol or anybody, he's looking somewhere else and talking. So there is no attention span, there is no concentration, there is no focusing, there is no speech. These are the different symptoms of autism.
Okay, sir. So through it, we can get this that it is very important from the parent side that they should observe their child very clearly and very carefully. Because many times, when their child is doing something hyperactive activity, in generally in India, basically, what parents think that our child is ill mannered. They most of the time they shout at the child that what are you doing.
Hmm.
They don't understand that there is something issue with their child. Most of them they suppress their child, and even sometimes, sir, I think parents might even hit their child, if
Hmm.
I'm not wrong.
Yes,
You
yes.
know, so it is very important to to
And many a
understand.
times, Mansi, you've seen that boys are usually hyperactive, and it is a myth that ये लड़का है तो hyperactive है,
हाँ,
लड़की है तो वो शांत बैठेगी, लड़की है तो she will play with dolls, and boy
हाँ,
है तो वो कार से खेलेगा. So
yes,
many a times it is also taken that don't label my child.
Huh.
My child is normal. The first thing that we need to understand is recognize the symptoms of autism and
Hmm.
catch them as early as possible, because earlier you start the treatment for autism, be it homeopathy, allopathy, speech therapy, occupational therapy, ABA therapy,
Hmm.
whatever therapies you do, start early. Start recognizing.
Huh.
Don't feel shy to take your child to a psychologist or a psychiatrist or a
Yes.
homeopath. डोंट थिंक दैट अरे मेरे चाइल्ड को लेबल लग गया तो जिंदगी भर उसको प्रॉब्लम्स
Yes,
होते रहेंगे. डोंट डू लाइक दैट,
yes,
because you
sir.
are harming the child by doing that. So once you recognize that there is some problem in the child, immediately take him to a doctor, take him to a homeopath, and that will help him recover faster, which is very, very important.
Yes, sir. Many times, parents shy that is that my child is mentally retarded or something. That
Mhm.
you know, our neighbors get to know about their child.
Mhm.
So many times they also have that peer pressure and all. You
Yes.
can say that.
There's a lot of competition nowadays. Everybody, it's like, going in CBSEs or ICSE schools. Even if you don't afford, you have to put your child in CBSE school or ICSE board, right? The
Uh,
thing is that अगर उसका बेटा ऐसा है तो मेरा बेटा भी, so a lot of comparison between
there
children,
is a lot of
which
competition.
is the worst thing. I always tell parents that never ever compare your child with the child other in the other other flat or in the other room or whatever, or your friend's child, because everybody is different. Just like our fingers are different, they are not of the same size, functions are different. Similarly, all children are different, so never ever compare your child with somebody.
Yes, sir. Even sir, I have seen that many parents suppress their child's talent.
Yes.
Recently, sir, I have a case that where parents suppress her daughter's talent. Like earlier, her daughter was very good at academics, but after some age, when she came in ninth, so she developed her interest in painting, dancing. So parents keep suppressing her talent. That what are you doing? That these things are not so important. They are not gonna help in your future. So, sir, is suppressing the child's emotion? It is also a cause that can, add on in autism.
Uh, I wouldn't say suppressing the child or beating the child or hitting the child can, but when we talked about the secondary type of autism, now remember, these
Sir.
ailments could be very, very important. Remember that. Because the child, many a times I have seen children in second year or third year, they were okay, everything was doing okay, and they put the child in a creche, and then
Uh,
he started regressing.
okay.
Or maybe he had a pet, and the pet died. His
Hmm.
father was transferred outside the country or outside the state, and the father went away or the mother went away. Some death in the family. He was attached to his grandmother, and his grandmother died. Or there is another sibling born in the family, which is very, very important. We have a very, very important rubric in our repertory, jealousy. And
Yes.
jealousy, when the newborn gets all the attention. And there are only
Okay.
two remedies, hyoscyamus and ignatia, and I've used them very, very frequently. Remember that, because the child starts developing autistic symptoms when the new child is born. Remember.
So also, sir, there is a rubric in this line that jealousy after the born of
Yes,
the
yes.
child
Jealousy, yeah, jealousy when, so
particular.
jealousy in children, the
Huh.
rubric is jealousy children in when newborn gets all the attention. And there are only two remedies, hyoscyamus and ignatia. And I've given both the remedies in
Huh.
various children, hyoscyamus also and
Huh.
ignatia also. Now, hyoscyamus is there, is a very, very jealous, suspicious
Hmm.
child. When the newborn child is there, he will
Huh.
go and hit the child, he will pinch the child, he will kick
Okay.
the child when the mother is not there. Are you getting it? This is
Jealousy.
very, very important because he's very jealous and suspicious. But
Mm-hmm.
Ignatia is a moral child.
Okay.
Ignatia will just expect love, his share from the
Huh.
mother member. He will say, Mom, you can love the new child, but give me my share of love. Don't give my share of love to the other child. So
Mm.
Ignatia will not harm the child. Ignatia will go into disconcerted state. He will become sad. He'll become angry. He'll become go into grief. But Hyoscyamus child is very, very cunning, manipulative, and it will harm the child. So this
Huh.
is to ask the mother, okay, what does this child do? The mother would say that whenever I go to the bathroom or whenever I go to the office, he starts pinching the child, he starts kicking the child. We have also seen it on the video camera, on the CCTV camera, that when nobody is around, he will do something to make the child cry.
Okay. Okay.
This is higher SMS, remember. This is great.
So it's really nice to know that we have such particular rubrics in our repertories. I would like to.
Because this is what is important. Is to find out the PQRS symptoms. Remember, when parents come to us with their autistic child, they will rattle out the symptoms of autism, which they know better than all of us. Remember that because they have gone through so many research and so many papers and so many internet and so many doctors that they know they have done PhD in autism, which even we don't know. So they are the best teachers of all us homeopaths as far as autism proper symptoms are concerned. But you have to tell them, please, I am not interested in the symptoms of autism. Tell me the symptoms of your child, which differentiate your child from other children. And those are the symptoms that I'll use in forming the totality of this. Okay.
Okay, so I would like uh, to tell this audience that we are having very really good rubrics from this session. So please keep your diaries and pen ready so that we will not forget. Because sir,
I'll tell you all the rubrics that are very, very useful in my practice. And
okay,
one of the rubrics is, of course, jealousy, which we have seen and which is very, very clinically important. And I have seen it in many, many cases where you can apply this, especially when the child is very, very temperamental, very, very, jealous and suspicious and does not allow his mother to go anywhere. Hyosamus, right? How the hyosamus child is. But
yes,
it is a very, very important remedy for jealousy. Remember that.
yes, sir. So, sir, did you prescribe the Hyoscyamus and Ignatia simultaneously or
No,
one
no, no,
or
no,
not?
no. How I am? No, no. I told you they are different remedy. They are in the rubric jealousy, but
Okay.
jealousy of hyosamus is different and jealousy of
Ign-
ignatia is different. So you
Okay,
can't give it to the same because hyosamus can never be ignatia and ignatia can never be
we
hyosamus.
will counter
Yeah.
it.
Yeah.
Okay, sir. So, sir, any other points that you would like to share while taking the case of autism, or
Mhm.
how to first approach such cases? Because, sir, these cases required very sharp observations when
So
when such patients came for the prescription. So, what how to start as the home?
see, when the child comes in front of you, you see that first of all, what is the pattern of the child? Now, I am really thankful to Dr. Barwalia sir, who's taught me whatever I know about autism. So I'm really thankful and lots of gratitude to Dr. Praful Barwalia from Mumbai, the Spandan Foundation, where I've learned a lot from him. So right in the beginning, he told us that whenever a child comes to you in front of you, you have to differentiate him into what pattern he is. Now, every child comes up with certain pattern. One pattern is the motor pattern. That means this child will be a lot of hyperactivity, running here and there, jumping here and there, as if there is a motor, and you have to continuously see. The mother has to continuously take care of the child. So this motor pattern is there. Are you getting it? This is known as the motor pattern or kinetic pattern, where the child shows symptoms of lot of hyperactivity, impulsivity, associated with maybe aggression, destruction, or violence. Here you can come to a group of remedies. You know the hyperactive group of remedies are tarantula, stramonium, tuberculinum, medorinum, nux vomica, etc., etc. At the same time, the child could also have a lot of self-injurious behavior. Well, he'll scratch his face, he'll bang his head on the back, striking the head. So there are many rubrics like this where they injure themselves. And one of the most important remedies is lycinum or hydrophobium, stramonium, tarantula, tuberculinum, belladonna. These are the kinetic motor pattern and self-injuries. Now there is another pattern which is called sensory pattern. Now this pattern of child will always be very hypo or hypersensitive to everything, to either touch, to noise, to taste or whatever. Now remember, autism is all about hypo and hyper functioning. There is no normalcy. Ultimately, when you give homeopathic remedy, you are going to bring the child to normal. So the child is either in the hyper mode or it is a hypo mode. When he's in the hyper mode of noise, remember that he will not be able to listen to even slightest sound also, and little sound, and he will put his hands on his ears, so he cannot bear the slightest noise, slightest touch. These are the people who are hypo. At the same time, they'll be hyper which will be hypersensitive, sorry, hypo, which will make a tendency to make a lot of noise. But these
Oh,
are two different children, remember. One child will come who will be sensitive to the slightest noise, another child will come with inclination to make noise, remember. One child will have aversion to touch, will not allow anybody to touch, he'll cry immediately when you try to hold him. Another child will caress you, cuddle you, come close to you. So are you seeing it? So there are a different spectrum. So this is the sensory aspect. So there is a motor aspect, there is a sensory aspect, and the third aspect is the regressive. That means these child who are nearing mental retardation. Remember that. Mental retardation is where the child spits, puts his saliva all over, maybe he passes stools, he starts eating his stools. Remedies like Baraitaka, remedy like Bufo, these remedies will come close. So a child will come to you with mixed pattern, but try to find out which is the most predominant pattern, whether it is sensory pattern, motor pattern, or regressive pattern. Depending on that, you can narrow the spectrum of remedies, and your
yeah.
task becomes much more easier.
Okay, so we learned three patterns in the autism child, that is motor pattern, sensory pattern, and regressive pattern.
Yeah, yeah,
Okay, so these patterns, they help us to segregate the medicines according to the totality of symptom. So it will become, yeah, obviously will become easy for us to prescribe the sibilimum.
yes.
Okay, so
For example, when I'm telling you a child who likes to make noise, so there is a rubric called noise inclined to make, of which belladonna is one of the most important remedy. So these
uh,
belladonna children, when they come to us, they are very very hyperactive, but at the same time they have this sensory component.
oh,
So they will immediately, on the table they will bang, and the mother would always say that he likes to play a lot. Playful is a very very important rubric of belladonna. Playful, play desire to, and
mm,
noise inclination to make. If you would take these three symptoms, the only remedy that you get is belladonna, and therefore belladonna becomes a very very important remedy in autism. Remember that. Okay.
all right. Okay, sir. And sir, you have told us that many child, they shut their ears when they have any type of noises.
Mhm.
So, sir, sometimes can we get confused between the rubric sensitivity and irritability? So, how to differentiate between these two rubrics?
Yeah, sensitivity is the basic rubric, right? Irritability comes after that. I mean, when the child is sensitive, he may just close his eyes, but
Huh,
need not be that he is irritable.
huh.
Irritability is when he expresses irritability in some way or the other, by anger or by
Oh,
throwing things or whatever. So somebody who's sensitive to noise will just put his hands on his ears, but somebody who reacts to that
yeah.
sensitivity,
Okay, okay, okay.
either by irritation, by irritability, by throwing things, by anger, by meltdown, by
Oh,
temper tantrum, then are you getting it? So chamomilla is sensitive and irritable. Nux
huh,
vomica
huh.
is sensitive and irritable. This is how. So you take sensitivity as a basic
Mhm.
thing and qualify it with irritability. Are you getting it?
Okay, okay, okay. Thank you so much, sir. Okay. Any other questions from the audience if they want to ask that how can we get difficulty while case taking in an autism child?
I'm,
So,
I'm sure there are around 44 people here, 44 doctors. They must have cases of autism. If you have anything which you want to share or you want to talk or you want to ask me, not that I am an expert in autism, I am just like all of you, a simple homeopath. So we can all discuss if you want.
yes, sir, sure. Asha, sir, I have many times I have seen that many doctors prefer to take, case taking. They prefer a format
Mhm.
that this it is a very long type of form, you can
Mhm.
say.
Mhm.
So, sir, is it important to get that case taking from that format only, or we can also have the case taking in the in our own way, like
Mhm.
every homeopath have a different case taking
Yes, it's very important. Now,
experience.
Mansi, the first thing that we learned in homeopathy, when I think you were in your first year, I was also in first year,
Hmm.
everybody used to come and say homeopathy is a art and science.
Yes, sir, sure.
Science because it is based on the principles, law of
Huh,
stimulus and everything, law of
huh.
nature. Art is something that we have to develop, remember.
Develop. Okay, sir.
Science can be learned, but art has to be developed. And every time when you become experienced, 1 year, 2 year, 4 years, 6 years, 10 years in practice,
Uh-huh.
you start developing and you start knowing that having a fixed case paper does not really help, because
Oh,
every child, every adult, every person is a different. So a tailor-made case paper form will not really help you.
okay.
What is important is just keep your eyes open. As Hahnemann said, all your senses,
Hmm.
keen senses,
Yes.
dedication, fidelity in tracing the picture of the disease,
Hmm.
circumspection. All these are the qualities of a physician, the do's and don'ts, remember, of the physician. So when the patient comes in front of you, when the child enters your clinic, it's very, very important that you just keep looking at the child rather than writing, writing, writing. Just look at the child. Maybe
Ah.
look down only to write one point, but immediately see to it what's going on, the chemistry between the child and the parents, how the
Ah.
child is moving around, whether the child is curious, whether he's coming near you, whether he wants to be hugged, whether he's running away, whether he's crying, whether he's listening to his parents or not listening to his parents, whether the child came first and the parents came afterwards, or the parents came first and the child came afterwards.
Hmm.
All these are small small things which you will feel, अरे उसमें क्या, ये तो ठीक है, तो चलता है.
Ah.
No, these are the most important
These
observations
are the
which will
important.
help you in coming to the remedy faster. Remember, if you have good observer,
Hmm.
your remedy diagnosis will be faster. If you are
Hmm.
not a good observer, you will diagnose the remedy, but maybe after 2 hours or after 1 hour. So
Ah.
now it depends upon you whether you want to diagnose the remedy and give the remedy in first 5-10 minutes, or take half an hour or 1 hour or 2 hour.
Hmm.
Okay, so that depends upon how you want to treat your patient.
Yes, sir. Of course, even in our organon, we always study to be uh, unprejudiced
Unprejudiced
and
observer, right?
to be very a keen observer
Yes.
to find the
Case
simile.
taking is important, format is important. I'm not saying that the format is not important. Yes, we have to cover
Yes,
all the symptoms,
it can help as
but
the
it has to be, it has to be used as a adjuvant, as a supplement, not as a main thing. Remember, the main thing is observation. Mm.
and that like like repertories are helping hand. So
Yes.
that format is also important. That sometimes the uh, any question does not come up in your mind. So through that form, we can get an idea of questions that we should ask.
So observation is the most important thing, and I would appeal to everybody who's listening, and I'm sure they also know that if you observe the child properly, in the first 5 to 10 minutes, you will come to the diagnosis of the remedy. But if you don't observe and you keep writing down with your head down and you're writing and you're trying to type the symptoms, you lose a lot of important symptoms that you could have observed before. Remember, that is very, very important. So, see, look at the parents, talk to the parents, look at the child, what he is doing, what she is doing, whether they are sitting, they're restless. Immediately find out a pattern, whether it is a sensory pattern or a motor pattern, and think of the remedies.
Okay, sir. Okay, sir. We have a question from the audience. Like Pratiksha is asking, please explain, sir, about regressive pattern. So can you explain again, please?
Regressive pattern is something like it comes close to mental retardation. Remember that. Now, remember autism spectrum, it is known as autism spectrum disease. That means it is a spectrum. Okay. On the
Huh.
left side of the spectrum, right side of the spectrum. On the left side of the spectrum, it you could have, cases which are like mentally retarded, and these people who are, they just cannot talk, they
Huh.
pass stools, they have no bowel bladder control, they pass tools there. They put their saliva on the table and apply on the saliva.
Hmm.
Absolutely problems, delayed learning.
Hmm.
That is regressive pattern. Are you getting it? So there are remedies like Alzheimer's, Pufo, Baraita, which come close to this pattern. I'm not saying that these are the three remedies only. There could be many other remedies. But remember that these three remedies can form the basis, and you can think later on. Now remember, on the other side of the spectrum are the very, very intelligent people. They are known as the autism savant. Remember the Shah Rukh Khan in My Name is Khan. These people have mathematical ability, drawing ability, creative ability, which are much, much stronger than even the normal children. If you see the movie Rain Man, in which Dustin Hoffman is there, I think everybody who wants to learn autism should see Rain Man. In this, the Dustin Hoffman, who is an autistic guy, is able to learn a whole part of the telephone directory. Remember, telephone directory. Remember, in olden days we had telephone directories. So
Uh-huh.
in a part of New York or in some city, I don't know which city at that time it is, but he's able to learn some 30, 40 pages of the directory with names and the numbers, which
Okay.
normally people cannot do. Remember, I had a patient of autism who was able to speak 5 languages. Now
Okay.
remember, this is something called autism 7. These are intelligent people. That's why it
Yeah.
is diagnosed as Asperger's syndrome. Remember. So
Okay.
the right side of the spectrum is very, very intelligent people, autistic children, but very, very intelligent. On the
Right.
left side are the regressive and the mentally retarded children. In
Hmm.
between, you got this mild to moderate autism. No, most of the patients, 90% patients we see is mild to moderate.
Mind advantage.
No.
Okay, so we learned movies also that we should watch to understand autism. Thank you so much, sir, for these suggestions also.
I think there was a movie by Naziruddin Shah also who was worked absolutely great. I think the movie was Earth or something. I don't know where he has acted the autistic adult. Remember that. So these movies really, I mean, movies. I have learned materia medica from movies. I am a materia medica teacher for the last 30 years now. But looking at movies, advertising, and observing people in the buses and trains and trams, it really helps you to understand materia medica. Remember, that's very
Yes, of course.
important.
Okay, we have another question from Archta that do hyperactive autism and ADHD seen together always?
ADHD is different. Remember, ADHD may come to you as a hyperactive autism, but autism is problems with relation, socialization, speech. ADHD will not have problem with relation and socialization. They can easily socialize with people. They can talk with people. There is no problem of speech in ADHD. There could be problem of focus. There could be a problem of attention, but there is no problem of speech in ADHD. Remember, autism there is a problem of socialization. They cannot socialize, they cannot communicate, they cannot speak. So ADHD can be a part of autism, but autism is not there in ADHD. Remember.
Hmm. There is difference. Okay, sir. So, sir, we have another question. I think Dr. Shisha want to discuss a short case.
Mhm. Yeah.
She's saying, sir, if a child has delayed development in talking, in socializing, even when turned 3 years after wants to be carried and lies on shoulders of only few people whom he recognizes, but the parents are reluctant to accept that something is not normal with their child and does not seek medical advice. What can be done, sir? Please guide.
No, first thing important in this case is you'll have to convince the parents, right? I mean, if parents are not ready to bring the child, you cannot force them to bring the child. First of all, you have to educate the parents that, okay, I think that there is some issue with the child because the way he's acting, that he only wants to be carried by certain people only. Now, remember, does not mean that it is autism. Now, remember, as homeopaths, we are not supposed to diagnose autism.
Hmm.
Yes, we can treat,
To observe.
okay, but we cannot label anybody autism because legally I don't think it is right that we are not trained psychiatrists. Remember that
Ha, ha,
we have read psychology, we have read psychiatry, though we
ha.
know everything, but we are not supposed to diagnose psychiatric elements like that. So we cannot say that okay, this child is autism, because
Ha,
they can hold you in contempt. They can hold you responsible if you give some diagnosis which
hmm,
they otherwise find out that it is not there. Then there could be a problem. Remember that.
ha. We
So the
can.
first thing, yeah, the first thing I tell parents is that whatever the diagnosis be, we as homeopaths don't give importance to diagnosis. We look at the symptoms of the patient and we treat the symptoms of the patient. So whether it is autism, ADHD, mental retardation, for me as a homeopath, it's not important.
Hmm,
Yes, when evidence based is there, I will refer the child to a psychologist, do the tests what are required before and after test, after the homeopathic remedy and before the homeopathic remedy,
ha,
but I will not diagnose. So it's very, very important that as homeopaths, we need to play safe. We
ha,
should not fall into the trap of diagnosing, because parents will come to you and in spite of knowing the diagnosis, there are chances that they'll ask you what is the diagnosis. And
ha,
they do have papers, they do have prescriptions, everything, but they'll still, to test your knowledge, they will ask you. Remember that. But my experience is that you should be very, very careful in saying some diagnosis which can really cause problems. Remember that, because they can hold you responsible later on. So just treat him, convince them that okay, don't worry, the diagnosis for us is not important. For us is important is that you give me a proper data, proper history, and I will treat your child. Okay.
Yeah, it's even it's our first duty to educate the parents.
Exactly, exactly. In fact, if you educate one parent and tell them that tell this to all your friends, or
Uh,
tell it to all the other parents, is also very very important. Taking parent meetings are very very important. Remember that. As homeopaths, we do a lot of camps. Remember, in the beginning of our career, we are doing camp here and camp there, everywhere camps we are doing. But nobody does camps for parents and tell them what children are, what your
uh,
children should be, how your behavior towards your child should be. No beating, no hitting, no taunting the child. These are very very important things which are very very important in development of the child. Remember that. So
yes, sir,
such
of course.
kinds of camps and
They should be.
seminars should be done.
Yes, sir, of course. Awareness and education is always important. Even we learned in our PSM.
Yeah, true.
Okay, so next we have question from Dr. Shazia Khan. Hello, sir. How much scope we have in treating apraxia with ASD? Apraxia with ASD.
Scope is always good. Apraxia and ASD is like any other disease. Again, I'm telling you, see that the important thing is don't stick to the diagnosis, or don't stick to the red flags of the allopathic system. Remember that. Simple example I'll give you, when they say vitiligo, for example. In vitiligo, they say the lip tip vitiligo or vitiligo on the joints has bad prognosis. But as homeopaths, we don't have bad prognosis or good prognosis. If we get good symptoms, if we get a good data, if we get good mother's history during pregnancy, if you get characteristic symptoms of the child, whatever the problem is, it can be treated. So Shazia, whether it is apraxia or whether it is ASD or whether ADHD or any psychological problem, what is most important is find out the PQRS symptoms. If you are able to get that, you will cross the border. Otherwise, you will not, because there is nothing specific in the repertory. There are many remedies for this or that, but giving specific does not work. Shazia, I think I know her. She's my student only. So
Oh,
Shazia, I have taught you, so you know that there are no specifics. So there is no remedy for apraxia and this. But if you take the case properly, and I'm sure you will do it.
okay, so we have an ominous review in between the session. That
Hmm.
session is very informative, gained a lot of knowledge.
Thank you very much. Thank
All
you very much.
credit goes to Dr. Samir, sir. All
The
right.
important thing is we have to share. That's very, very important thing. Whatever I do seminars or webinars all over the world, it is all about sharing. It is all about sharing experiences, sharing your failures also. This is very, very important because everybody shares their best cases. Nobody shares their failures, because failures, we
So,
learn from failures, not from successful cases. You have to
of
remember
course,
that. No?
sir. And it is always said that the ज्ञान बांटने से ही बढ़ेगा, sir.
Yeah, yeah.
Okay, next we have the question from Dr. Vikas Singhal. Autism have some relation with vaccination like MMR, OR, oral polio vaccine.
As I have told you, vaccines are not villains. Remember, जो हिंदी पिक्चर में villain रहता है और हीरो रहता है, राइट? सो वैक्सीन्स को वी हैव मेड विलन्स. Vaccines are not villains. Remember, vaccines have certain elements, maybe aluminum part or zinc part or whatever. Now
Hmm.
remember, we all have taken vaccines, isn't it? But we did not develop autism. If vaccines were a problem, all of us should have developed autism. The fact that only a few percentage of people who take vaccines develop autism means that they are inherently susceptible to develop autism. So there has to be a genetic predisposition and an exciting factor which can lead to autism. Now, the
Oh,
exciting factor could be vaccination, or it could be death of somebody, it could be the death of a pet, or it could be in the crash, the lady is not treating you properly, the lady is shouting on you, there could be some mental emotional problem. These are the exciting and triggering factors.
hmm.
But without genetic predisposition कुछ भी नहीं हो सकता. So there has to be a genetic predisposition on which there is an exciting event which will lead to autism. So again I'm telling you, don't blame vaccination and don't give just thuja or malandrium or antimunitard for bad effects of vaccination.
Right,
It will
right.
not act.
Okay.
It will
Yeah.
waste your time. Remember that the patients will come back to you again and again and again and again, because they need treatment. They feel that okay, doctor will give us treatment, they'll keep coming to you, but you will waste their time also, you will waste your time also. So don't look at bad effects of vaccination until unless the child is absolutely healthy, the child has no problem, the pregnancy was absolutely okay, and after vaccine there was a immediate change, regression was there, then maybe you can take this rubric, bad effects of vaccination. Otherwise it's a risky rubric to take, according to my experience.
Okay, okay. Okay, sir. And sir, one question from my side. Like many times, sir, when the parents came to us for a homeopath for autism cases, sir, first question they ask that how much time will it take to see the improvement in the child? So, sir, how to answer that question as a homeopath?
See, Mansi, my experience with autism is that it is very, very unpredictable. Remember that.
Okay, yes,
Okay.
sir.
So you cannot predict that this will get over in 3 months or 6 months. I have seen effects in 7 days also, and I have
Okay.
not seen effect in 1 year also.
Oh,
So the first thing is what I tell parents is I cannot predict. We
huh,
have to start the treatment first. Now remember, it was told to us in even in Organon that when we get the PQRS symptoms, when you get the characteristic symptoms, when you have got good cravings, when you got good aversion, you got sleep position, you got clear cut symptomatology, your results will be faster. So I follow the same thing. I mean, if I get good PQRS symptoms, which
okay.
are the symptoms that characterize the person, I always know that my result will be quicker. I may
Huh,
not be able to say 3 months or 6 months or 7 days, but
huh,
I'm happy that okay, I'm going to give good result to this child. Okay.
huh.
But when I'm taking the child's history, the parents are not able to give me proper history, or whatever symptoms I'm seeing are symptoms of the disease itself. There are no characteristic symptom, or it is a one-sided disease, as we were taught in homeopathy. Remember?
Hmm.
One-sided. तो वन साइडेड डिजीज में सिर्फ ऑटिज्म के ही सिम्टम्स नजर आएंगे आपको यू विल सी ओनली सिम्टम्स ऑफ ऑटिज्म एंड
Hmm.
यू विल नॉट गेट अ प्रिस्क्रिप्टिव सिम्टम
Hmm.
फॉर ऑटिज्म. Are you getting it? Such cases, there is a red flag and there is an alarm in your brain that, array, this case is going to trouble me.
Huh,
It's not going to budge very easily. It is going
huh.
to take a lot of time. So that
Hmm.
you'll have to put extra labor into it. Those cases will take time. But cases where you get some symptoms, PQRS symptoms, characteristic symptoms, you can actually predict within your mind, not to the patient, that okay, now I think I am on the right track and your remedy will work.
Oh.
So I always tell the parents of these children is that don't be happy with any progress and don't be sad with any going down, because autism is all about ups and downs, ups and downs, because they'll become emotionally charged. Remember, children who are not able to express their emotions, they'll start getting angry, they'll
Hmm.
start crying, they'll become emotional, because these emotions were not there in the child. Remember,
Huh.
after your simillimum, these emotions will start coming, and it is possible that the mother or father will say, what have you done with my child was so silent, he was never crying, he started crying now. This is what I tell them, that your child has started crying or laughing or enjoying. This is because his emotions are coming up through the simillimum, so be
Even
happy about
the
it.
parents also does not know the thing, na, sir, homeopathic aggravation.
Yeah, yeah, yeah.
They also don't know that.
They feel that it is a side effect, which we have to tell them that it is not a side effect. Children becoming emotional after the homeopathic
Yeah,
remedy is in a
yeah,
way good
emotion
sign.
is getting
It's a
out.
good sign. Yeah.
Okay, so basically, it is risky to say that it will take this much time and this much
I mean,
time.
until unless you have a boon from God and somebody tells you this is 7 days, so you can say 7 days. I don't have that, so I don't.
Of course, sir, treatment is not like that.
And
We
the best
have
thing is
to
to give the remedy and watch it act. I mean, tell them that, see, it is not a problem that you come after 15 days, you come after 20 days and let me know. The thing is, autism and such problems are to be followed every day or every 2 days,
yes, yes,
because
yes.
everything changes. Everything is very, very dynamic in autism. A little bit change can happen. The child will start smiling, or the child will start doing eye contact within the first day.
Huh?
Okay, so that
uh,
the parent has to report to you. Okay, after the first dose, such a thing happened. So tell the parents that you have to report to us or keep a diary at home, write down the changes, because by the time they come after 21 days or by after a month, they'll forget all these changes. Remember that. Are you
mm,
getting it? So make a diary of follow up or
okay.
protocols for them, isn't it?
Okay, sir. So basically, in short, we have to tell the parents that you have to trust the process.
Yes, absolutely. And for trusting the process, they have to be told. Remember, not all of them know what is homeopathy, or even if they know homeopathy, they don't know whether it will be good for their child or no. So you
Uh-huh.
have to explain them. It's very,
Okay.
very important to explain them. Once they know it, then your treatment becomes very, very smooth. Remember that.
Huh.
Because without telling them and without making them understand what is going to happen, they'll be surprised, they'll be panicking, they'll
Mm.
immediately go to the psychiatrist, they'll start other medicines. Remember, so you have to explain them properly.
Okay, okay, okay. Thank you so much, sir. So, any other questions from the audience? Uh, so we have another review from Vikas Singhal. That's a wonderful session.
Thank
And
you.
from
Thank you very much.
Rosista, thank you for sharing your knowledge. Always learn from you, doctor.
Rosita is a friend of mine. She's from UK and she's also a
Okay,
very, very, very good homeopath. And
okay, okay.
thank you, Rosita, for attending and thanks for your encouragement.
Thank you, Rosita. And thank you.
You can give the I mean, can they speak? If she wants, she can say something on this mic.
No,
Can
sir, the speaking option is only
they?
for the host of the
Uh,
meeting, but surely they can share her
okay,
experience in
okay.
the chat box.
You should keep the mic also open because people sometimes people want to talk, no? So you should anyway, no problem.
Yes, sir, of course, it is a good idea. From the next time, we can
Yeah.
do such things because even such type of interactive sessions are more, good way to learn.
Mhm. So there is an anonymous attendee who said very informative and gained a lot of knowledge. Okay, Vikas Singhal has said okay, okay, fine. So I hope today's session. Yeah, Jairam, Mr. Jairam wants to talk. He raised his hand. There is a question from Mr. Jairam. So you can put your question in the box, chat box.
Yes, if anybody wants to say something about the session or have any query, they can write in question answer box.
Hmm. Most important today, what I would like to suggest is always document your cases. Always uh, take testimonials from the parents of the patient. Always do tests in order to find out. Don't just look at the symptoms that the symptoms have disappeared.
Ah,
So there are certain tests called CARS test, and there is a attack test, and there is a VSMS test. These are the tests which help you in understanding how much the autism has progressed and how much the autism is healing after your homeopathic remedies, right? Because nowadays, internationally, whenever you talk on autism or whenever you teach autism, you need to have evidence-based practice. So just disappearance of symptom does not mean disappearance of the disease.
mm, mm.
Several symptoms should also be seen with lab reports, with investigations, with X-rays, with CT scans. Similarly, psychiatric reports, psychological reports. So please do all these things and keep it attached to your main case record. It will be really handy when you are presenting it in a seminar or a conference, especially in front of psychiatrists or allopaths or something. Because otherwise, they will not recognize us. Otherwise, it will not be a good way to practice homeopathy. We are modern homeopaths, remember.
Course,
So,
even of course, pathology is always important in every kind of cases.
yes.
It
No,
should
I
be
am talking about
done,
reports, basically reports, right?
basically reports, all the lab reports.
Okay, so I think it's already 9 o'clock, so we have passed 2 minutes of the time. So,
Yeah, yeah, sure, sir. Okay, sir. So
so
anything, sir, you want to say about the platform, about the Homeopathy 360, about your experience?
absolutely, 360 degrees is absolutely great platform. I've been knowing people in BJN and 360 platform for a long, long time. Manish is a very good friend. Ishan sir is a very good friend of mine.
Yes, sir.
Mohit is a very good friend. Mohit has been, doing a lot of things for me. So I'm really thankful to Mohit, to you, Mansi, very
Thank
much.
you, sir.
You're a very nice person and a very, very good smile you have. So
Thank
keep
you, sir.
that smile on. And thanks to all the listeners who patiently listened to my blabbering on autism.
Yes,
So
sir.
I have shared my experience with you. I have a lot of experience. So maybe we can have a autism part 2 also if Mansi or 360 degree wants. We
Sir,
could do autism
definitely.
2. We could do a ADHD. We could do a children's series also. So plus Materia Medica. Yeah, today we did not talk of too much of Materia Medica.
Yes.
Probably next time if there is some session like this, Mansi, we
Hmm.
can talk of the homeopathic part of autism.
Sir, definitely. We because sir, today we learned the basics, and basics are always important to learn about anything. So after that, sir, if you are okay, we will definitely have the
Sure,
part
sure.
two. And now I think we have few people saying. So Dr. Sirisha is saying, thank you so much, sir, for your valuable tips and encouragement, sir.
Mhm.
So we have very good reviews. Thank you so much, everyone. Wasima is saying it is a very, very good session and we expect for a second session.
Sure,
So
sure,
we so we are already have the demand of part two.
sure, sure. Whenever you want, I'll be available for you. Don't worry. Okay.
Okay, sir. Okay.
Hmm? Chalo.
Definitely.
Thank you very much. Thank you.
Thank you so much, sir, for
Mm.
giving us your valuable
Mm.
time, of course. And
Thanks to
learn.
360
learn.
and thanks to all of you for allowing me to talk on this platform. Thank you to everybody. Okay.
Thank you so much, sir. Thank you.
Bye bye.
Bye bye, sir.